So, the structure of my talk is, first I'll start with a review, CordBlood 101 we'll call it, covering off what is cord blood, talk about early cord blood transplant history, and then I'll outline some of the advantages and limitations of cord blood as a source of hematopoietic stem cells for bone marrow reconstitution. I'll describe cord blood banking itself, and I'll take you for a walk through our lab to see how we actually process cord blood and put it into our storage tanks. Then I'll describe, there are two different banking models out there, public and private, so I'll outline the differences between those for you. And then I'll discuss some of the ongoing trials, clinical trials with cord blood, going into a little bit of detail of studies which are ongoing to improve cord blood transplantations, and then also newer studies into applications of cord blood in regenerative medicine. So we'll keep this informal. If there's any questions, please feel free to interrupt as we go along. So first of all, what is cord blood? Well, cord blood is the residual blood that's left over in the umbilical cord after the baby is born. It's collected after the cord has been clamped. Typically, it's discarded as medical waste. And it was in studies conducted by Hal Broxmeyer at Indiana University in the 1980s that started demonstrating that cord blood was actually a source of hematopoietic stem cells, and they may contain sufficient cells, number of hematopoietic stem cells for clinical use. Hematopoietic stem cells are the cells within the bone marrow or mobilized peripheral blood cells that is responsible for regenerating the bone marrow during the transplantation. And the hematopoietic stem cells are the mother of all blood cells in your body. And like stem cells, hematopoietic stem cells share three general properties with all other stem cells. They are capable of division and self-renewal over a long period of time. So in adults, they typically reside in the marrow. You have a few which are circulating in your peripheral blood. They reside in your marrow, and they sit as a cell with two decisions to make when they divide. Will I self-renew and stay as a stem cell, or will I differentiate and become hematopoietic progenitors, which will then go on to form all of our differentiated blood cell types in our body? The one thing is they're capable of division and self-renewal for long periods of time, which of course is what you want, because if we live to 100 years old, we want to make sure we're still making blood to support us. They're typically unspecialized cells. They're just thinking of two things to do: renew or differentiate. And they give rise to the very specialized cell types. For the longest time, the true nature of the hematopoietic stem cell has been elusive. We've known little bits about it, but it hasn't been fully characterized. And it was just a couple of weeks ago that John Dick's lab down at University of Toronto actually reported on the characterization of the real, true stem cells. So there's a lot of excitement about that. So in terms of cord blood and the transplant history, the first successful cord blood transplant was conducted on a 5-year-old patient with Fanconi's anemia. And this is a fatal disease, leukemia. Not leukemia. It's a fatal disease which can only be cured with a transplant. And of course, you need a properly matched donor for the transplant. And this was it was truly an international collaboration. When this study was done in 1988, there was Hal Broxmeyer again played a pivotal role in collecting and processing the cord blood and storing it. And the transplant actually occurred in Paris, where the world expert at the time on Fanconi's anemia was working. So it was a successful outcome, and actually in 2008 they just celebrated the 20th anniversary of the first successful cord blood transplant. This is a picture, kind of small, showing the pioneers of the first cord blood transplant. And this was the recipient here, so age 25, and it was just a huge party, it seemed, that they had to celebrate this milestone. And he was essentially cured because of this transplant. And what this first successful transplant demonstrated was that a single cord blood unit does contain sufficient number of hematopoietic cells to support bone marrow reconstitution. Further, that cryopreserved cord blood was able to maintain its ability to repopulate the bone marrow. And that cord blood can be collected at birth without harm to either the child or the mother. So this pivotal cord blood transplant led to a series of firsts in the following years. In 1989, the first successful cord blood transplant to a 2-year-old using HLA mismatch. I should say with the first one, it was a perfectly matched, the source of the cord blood was a matched sibling. So the child was 5 years old at the time, the parents had a baby, turned out to be a perfect match for the sibling, and the transplant went ahead. The following year there was a transplant where there was a mismatch. It was from a sibling, but it was a 4 out of a 6 HLA mismatch. And that was a successful transplant as well. And that's remarkable when we talk about bone marrow or peripheral blood stem cell transplantations. Transplant physicians are looking for an 8 out of 8 match in terms of HLA, the different markers they use to look for a match. So this said or indicated that cord blood could be much more, you don't require as stringent of a match, which is one of the huge advantages with it. In 1993, the first unrelated cord blood transplant was performed in the US. So now, first two that I described were with siblings, and now they've moved from going from related to unrelated donors. And then earlier on, it was thought that, okay, there's only sufficient number of hematopoietic stem cells to support pediatric patients. And then in 1996, they did the first transplant into an adult. So again, just opening the doors more and more, increasing the application for cord blood. In 2000, it was reported that more than 1,000 cord blood transplants had been performed. So over the first 12 years, 1,000 cord blood transplants were performed. So it was picking up more and more. And it was during this time that several advantages of cord blood became apparent. First, no risk to the donor. After the baby is born, the cord is clamped, and then the blood is harvested at that point. Versus bone marrow, where it's an invasive procedure to harvest bone marrow, or peripheral blood stem cells, where you have to mobilize the stem cells before harvesting. Again, there are side effects associated with that. It's readily available. Cord blood stored in banks. If there's a transplant physician who needs it, do a search, they find a match. It's possible to have that cord blood in hand in a matter of weeks. In emergencies, they say it could be days. Versus if you're looking for a bone marrow donor, go to the registries, it could take weeks just to locate the donor. You know there's a perfect match out there, but then physically finding that person, it can take weeks, and then from that point, arranging to have the bone marrow in hand, that can take about 2 more months. So you can get it much quicker, which is depending on the patient and what they're being treated for. Sometimes speed is of essence. No donor attrition. Once the cord blood is in a bank, it is cryopreserved and it is safe in the bank. Bone marrow donors, again, they sign up for a registry. If you sign up for a registry when you're 20 years old, you're 40 now, when someone needs you, they find you and it's a case of tracking you down, or people lose interest, they get sick, or other things where they just fall off. So, and if they don't keep the bone marrow registry up to date, then you can get a lot of attrition that way. Cord blood coordination with the transplant site is very simple. If you have a patient who needs a transplant, you find the match, a suitable match cord blood, you can bring it to the transplant center before you actually start treating the recipient. If you think about a lot of leukemia patients, before they receive a transplant, they have to undergo myeloablation, so wipe out their bone marrow before transplanting with another one. So the advantage of cord blood, you can have it at the site ahead of time. That's because it's cryopreserved. Bone marrow and peripheral blood stem cell is usually not cryopreserved, so it's done fresh. And the half-life of bone marrow is on the order of hours versus mobilized peripheral blood cells, days to weeks. So when you're thinking of coordinating a donor coming in and giving your stem cells with the patient undergoing their conditioning regimen ahead of the transplant, it's a little more finicky that way. And it's one thing if it's in the same city, but a lot of times the donor is in one city and the recipient is in a different facility. So again, coordinating that because there's a lifespan with the bone marrow. And what happens if you were to start conditioning the patient and you have to start that ahead of the donor actually donating and the donor gets sick? So there's a bit of a crisis there. Or another example is if the donor is in Europe and the donor is in Canada, recipient in Europe, and a volcano in Iceland is spewing off volcanic ash. And that was speaking to Sue Smith of the Canadian Blood Services, actually last year. That was a real scenario, real life scenario. During the crisis when air traffic was at a halt, there were a couple of donors in Canada that had donated and they were shipping their bone marrow off, or mobilized peripheral blood stem cells, off to Europe, and then the shipments were interrupted because of the volcano. So fortunately they used some creative backup plans to get the stem cells where they needed to go, but you can just see logistically if you can have the cord blood in hand ready to transplant ahead of treating the patient, it's much simpler. HLA matching is not as stringent. Using cord blood as bone marrow, as I mentioned, mismatches that can be tolerated. 4 out of 6 for cord blood, and they match HLA, A, B, and DRB1. Bone marrow or peripheral blood stem cells typically require an 8 out of 8 match, where they also look at HLA-C.